Benefited, less if you are feeling burning in your feet, numbness in your toes, stabbing pain in your hands, or that strange pins and needle sensation that just won't go away, your body is not betraying you. It is communicating with you. Benefited, that discomfort, that irritation, that electric shock feeling running through your nerves is a signal. And signals are not meant to be silenced, they are meant to be understood. Neuropathy doesn't start overnight. It builds quietly. Benefited, it whispers before it screams. At first it may feel like mild tingling. Then it becomes persistent numbness. Then it turns into burning pain that keeps you awake at night. Many people reach for quick fixes, temporary relief. Fitted, pills that mask the symptom but never address the cause. But if you truly want change, you must go deeper. The nerves are crying out because something in the internal environment is out of balance. Fitted, your nerves are like electrical wires. They depend on oxygen, blood flow, nutrients, and stable blood sugar to function properly. When circulation decreases, when inflammation rises, when blood sugar spikes repeatedly, those delicate nerve endings begin to suffer. And when nerves suffer, you feel it sharply. One of the most powerful steps you can take is to stabilize your blood sugar. Even if you are not diagnosed with diabetes, frequent sugar spikes can damage nerves over time. Every time blood sugar rises too high, it creates oxidative stress. That stress irritates the lining of your blood vessels, reducing circulation to the smallest nerves in your feet and hands. Over months and years, that damage accumulates. The solution begins with awareness. Reduce refined sugars. Cut back on processed carbohydrates. Choose whole foods that keep your blood sugar steady instead of sending it on a roller coaster ride. But nutrition goes beyond sugar. Your nerves require specific vitamins to heal and regenerate. B vitamins, especially B1, B6, and B12, are critical for nerve health. When these are deficient, nerve pain can intensify. Magnesium plays a role in calming nerve overactivity. Benefited, alpha-lipoic acid is a powerful antioxidant that supports nerve repair. The body cannot fix what it does not have the raw materials to rebuild. Give your body what it needs and it will respond. Circulation is another key. Benefited, nerves cannot heal without blood flow. Movement is medicine. Even gentle walking increases oxygen delivery to damaged nerves. Stretching improves microcirculation. Simple ankle rotations, calf raises, benefited, and toe movements can stimulate the tiny blood vessels that feed those nerve endings. You don't need extreme workouts. Consistency beats intensity. 5 to 10 minutes several times a day can change the environment inside your body. Benefited, inflammation is a silent amplifier of neuropathy pain. Highly processed oils, excessive sugar, chronic stress, and lack of sleep all increase systemic inflammation. When inflammation rises, nerves become more sensitive. Fitted, foods rich in omega-3 fatty acids, colorful vegetables packed with antioxidants, and adequate hydration all help reduce that inflammatory burden. Sleep is not optional. During deep sleep, the body repairs. If you are depriving yourself of rest, Fitted, you are delaying healing. Stress deserves special attention. Chronic stress increases cortisol, tightens blood vessels, and restricts circulation. It also heightens your perception of pain. The nervous system becomes hyper-alert. Simple breathing techniques can calm this overactivity. Slow, benefited, controlled breathing signals safety to the brain. When the brain feels safe, the body relaxes. When the body relaxes, blood flow improves. Healing accelerates. Now let's talk about the burning sensation. Benefited, that fire-like feeling is often caused by irritated sensory nerves misfiring. Cooling therapy such as contrast baths, alternating warm and cool water, can stimulate circulation and calm nerve endings. Fitted, gentle massage can improve lymphatic drainage and reduce swelling around nerves. But remember, massage should be gentle. Aggressive pressure can worsen sensitivity. If numbness is your primary symptom, benefited, that is a sign that nerve signals are not traveling effectively. In that case, stimulation exercises are helpful. Light tapping, soft brushing, and texture exposure can retrain the nerves and brain connection. Neuroplasticity, the brain's ability to adapt, is powerful. Even damaged nerves can regain function when stimulated properly over time. Stabbing pain, Fitden comes in waves. That sharp electric jolt can be frightening. But fear itself intensifies pain. When you anticipate the pain, your muscles tighten. When muscles tighten, circulation drops. When circulation drops, pain increases. Break that cycle. Benefited, when a wave comes, breathe through it. Relax your jaw, relax your shoulders. Tell your body you are safe. This may sound simple, but the nervous system responds dramatically to emotional signals. Hydration is often overlooked. Fitted, dehydration thickens the blood slightly, reducing optimal flow to peripheral tissues. Drinking adequate water supports circulation and cellular function. It sounds basic, but basics build the foundation of healing. Avoid toxins that damage nerves further. Excessive alcohol is directly toxic to nerve tissue. Smoking constricts blood vessels and reduces oxygen delivery. If you truly want improvement, remove the obstacles to healing. Benefited, the body is constantly trying to repair itself. Your job is to stop interfering with that process. Be patient. Nerves heal slowly. Unlike muscle tissue, nerve regeneration can take months, but improvement is possible. Small gains add up, less burning, fewer stabbing episodes, slight. Why improve sensation? Celebrate progress no matter how small. Do not ignore foot care if neuropathy affects your feet. Inspect daily. Reduced sensation means you may not feel injuries. Proper footwear reduces pressure points and improves alignment. Benefited, which can reduce nerve irritation. The most important thing to understand is this neuropathy is not just about the nerves. It is about the environment surrounding the nerves. Change the environment and you influence the outcome. Lower inflammation. Improve circulation, stabilize blood sugar, nourish deficiencies, manage stress, move daily, sleep deeply. Your body is incredibly intelligent. It is not attacking you, it is responding to conditions. When you improve those conditions, fitted, you create space for healing. Pain is not always permanent. Numbness is not always irreversible. Burning is not always forever. You have more control than you think. Each meal is a decision. Each walk is an investment. Each glass of water is support. Fitted, each night of quality sleep is repair. Healing is rarely dramatic and instant. It is gradual and steady. But steady change transforms lives. Listen to your body. Respect its signals. Give it what it needs. Fitted, remove what harms it. Support it consistently, and watch what begins to shift inside you. When you feel burning, numbness, or sharp stabbing pain, it is easy to focus only on stopping the discomfort. That reaction is natural. Pain demands attention. Fitted, it interrupts sleep, concentration, movement, and peace of mind. But pain, especially nerve pain, is rarely the true problem. It is a signal. It is the body's alarm system telling you that something deeper is out of balance. Benefited, if you silence the alarm without addressing the fire, the damage continues quietly beneath the surface. Neuropathy does not appear randomly. It develops when the internal environment of the body begins to shift in unhealthy ways. Benefited, one of the most common root causes is unstable blood sugar. Even mild, repeated spikes in blood glucose can irritate and damage delicate nerve fibers over time. The smallest blood vessels in the body feed the smallest nerves, fitted, particularly in the feet and hands. When blood sugar remains elevated, it damages those vessels, reducing oxygen and nutrient delivery. Without proper nourishment, nerves begin to weaken, misfire, or lose sensation. The result is tingling, burning, or numbness that seems to come out of nowhere but has actually been developing for years. Inflammation is another major driver. Chronic inflammation creates a hostile internal environment. It thickens the blood slightly, irritates tissues, and sensitizes nerve endings. When inflammation surrounds a nerve, that nerve becomes hyper-reactive. It sends exaggerated pain signals to the brain. What might normally feel like mild pressure can feel like sharp discomfort. Inflammatory foods, excessive sugar, processed oils, lack of sleep, and chronic stress all contribute to this ongoing inflammatory state. The body cannot heal in an environment that is constantly inflamed. Circulation plays a central role. Nerves are living tissue. They require a steady supply of oxygen, fitted, glucose in stable amounts, vitamins and minerals. Poor circulation deprives them of what they need to repair. Sedentary lifestyles, tight muscles, smoking, dehydration, and vascular problems can all limit blood flow to peripheral nerves. When circulation is compromised, waste products accumulate and nutrients fail to reach damaged areas efficiently. Over time, nerve fibers begin to deteriorate. Nutrient deficiencies are often overlooked. T extremely important. B vitamins, especially B1, B6, and B12, are essential for nerve structure and signal transmission. Without adequate levels, nerve insulation weakens and electrical impulses become unstable. Magnesium helps regulate nerve excitability. Antioxidants protect nerve cells from oxidative stress. If the body lacks these building blocks, repair becomes difficult. Simply taking pain medication does not supply these missing nutrients. The body needs the raw materials to rebuild. Toxins also contribute to nerve damage. Excessive alcohol directly injures nerve tissue. Smoking constricts blood vessels, reducing oxygen delivery. Benefited. Certain chemicals and heavy metals can accumulate in tissues and interfere with nerve signaling. When toxins build up faster than the body can eliminate them, nerves may suffer the consequences. Benefited. Removing these obstacles is just as important as adding supportive habits. Chronic stress deserves serious attention. When stress hormones like cortisol remain elevated for long periods, blood vessels constrict, circulation decreases, inflammation increases, muscles tighten and compress nearby nerves. The nervous system becomes hypersensitive. This benefited end state amplifies pain perception. The same nerve signal feels stronger and more distressing under stress. Healing requires shifting the body from constant fight or flight mode into a calmer, more restorative state. The mistake many people make is treating neuropathy as an isolated nerve issue. In reality, it is often a systemic condition. The nerves reflect the health of the entire body. If blood sugar is unstable, inflammation is high, circulation is poor, benefited, and nutrients are lacking, the nerves are simply the first to show visible symptoms. Addressing only the surface discomfort misses the deeper imbalance. Healing begins when you change the internal environment. Stabilize blood sugar by reducing refined carbohydrates and increasing fiber-rich whole foods. Support circulation through gentle, consistent movement. Reduce inflammatory triggers by improving diet quality and prioritizing sleep. Manage stress through breathing exercises, prayer, meditation, or time in nature. Correct nutrient deficiencies with proper medical guidance and balanced nutrition. Eliminate harmful habits that restrict blood flow or introduce toxins. Benefited, this approach requires patience and commitment. Is rarely an overnight fix. Nerves regenerate slowly. However, when the internal environment improves, small positive changes begin to appear. Burning episodes may become less intense. Numb areas may regain slight sensation. Benefited, stabbing pains may occur less frequently. These small improvements signal that the body is responding. Understanding that pain is a messenger changes your mindset. Instead of fighting the symptom, you begin listening to it. Instead of suppressing it, you investigate it. The goal is not just comfort but correction. When you address the root causes, you are not only reducing neuropathy symptoms, you are improving overall health. Blood vessels become healthier, inflammation decreases, energy improves. Benefited, sleep deepens. The entire system benefits. Your body is not broken, it is adaptive. It responds to the conditions you create. If those conditions promote inflammation, instability, and deficiency, nerves will struggle. Fitted. If those conditions promote balance, nourishment, and circulation, nerves have the opportunity to repair. The choice lies in daily habits, consistent effort, and a willingness to look beyond the surface of pain. Your nerves are not just wires carrying benefited G signals. They are living, dynamic tissues that depend on constant nourishment, oxygen, and protection. When they begin to malfunction, the solution is not simply to quiet them down. The solution is to restore them. Benefited nerves have an incredible ability to regenerate when the environment supports healing. But they cannot repair themselves in isolation. They need the right fuel, the right circulation, and the right internal balance to rebuild and function properly. Benefited, blood flow is the foundation of nerve health. Every nerve fiber relies on tiny blood vessels to deliver oxygen and nutrients. Without adequate circulation, those fibers begin to weaken. Think of it like a garden. If water cannot reach the roots, the plant slowly dries out. The same happens inside your body. When circulation improves, oxygen delivery increases, waste products are removed more efficiently, and damaged nerve tissue receives what it needs to regenerate. Gentle, consistent movement is one of the most powerful tools for restoring circulation. You do not need extreme exercise. Even slow walking, ankle rotations, calf raises, stretching, benefited, and light resistance movements activate the muscle pump that pushes blood back. Benefited toward the heart and out toward the extremities. Consistency creates momentum in the healing process. Nutrition is equally critical. Benefited. Nerve cells require specific vitamins and minerals to maintain their protective covering and transmit signals accurately. B vitamins play a central role in this process. Vitamin B1 supports nerve metabolism. Vitamin B6 helps with neurotransmitter balance. Vitamin B12 protects the myelin sheath, the insulation around nerves that ensures signals travel smoothly. When these nutrients are deficient, signals become distorted. Burning may intensify. Benefited, numbness may spread. Weakness may appear. Restoring proper levels gives the body the tools to rebuild damaged nerve pathways. Magnesium is another essential mineral often overlooked. It helps regulate nerve excitability and muscle relaxation. When magnesium levels are low, nerves can become hyperactive, increasing tingling and sharp sensations. Adequate intake through leafy greens, nuts, seeds, and proper supplementation under guidance can calm overactive nerve responses. Antioxidants also play a major protective role. Nerve cells are highly sensitive to oxidative stress. Free radicals damage cell membranes and de-impair repair mechanisms. Nutrients such as alpha-lipoic acid, vitamin C, and vitamin E help neutralize this damage and support regeneration. Hydration supports every one of these processes. Blood is primarily composed of water. When dehydration occurs, blood becomes slightly thicker, reducing efficient circulation to small vessels that supply peripheral nerves. Adequate hydration ensures smoother flow, better nutrient delivery, and improved waste removal. Something as simple as drinking enough water consistently throughout the day can subtly improve the internal environment in which nerves attempt to heal. Rest is often underestimated in nerve recovery. During deep sleep, growth hormone is released. Tissues repair and inflammation decreases. Chronic sleep deprivation interrupts this process. If you consistently cut your sleep short, you interrupt your body's natural repair cycle. Nerve regeneration requires energy and restoration. Benefited, prioritizing quality sleep creates a powerful foundation for healing. Stimulation is another key factor. When nerves are damaged, communication between the brain and body can weaken. Gentle stimulation helps retrain these pathways. Light messages, Fitted. Off brushing of the skin, exposure to different textures, and controlled temperature changes can activate sensory receptors and encourage neuroplasticity. The brain has the ability to reorganize itself. Fitted. When you consistently stimulate affected areas in a safe, controlled manner, you reinforce the connection between nerve endings in the brain. Over time, this can improve sensation and reduce abnormal firing patterns. Inflammation must remain low for regeneration to occur effectively. Highly processed foods, excessive sugar, poor quality fats, and chronic stress increase inflammatory markers. Anti-inflammatory foods such as leafy greens, berries, fitted, fatty fish rich in omega-3 fatty acids, nuts, seeds, and colorful vegetables create a calmer internal environment. When inflammation decreases, pressure around nerve fibers reduces and sensitivity often lessens. Benefited. Breathing and stress management influence nerve health more than most people realize. Chronic stress activates the sympathetic nervous system, constricting blood vessels and reducing peripheral circulation. Slow, fitted, controlled breathing stimulates the parasympathetic system, encouraging relaxation and improved blood flow. Even 5 benefited minutes of deep diaphragmatic breathing several times per day can positively affect circulation and nerve recovery. Avoiding substances that directly damage nerves is essential. Alcohol in excess is toxic to nerve tissue. Benefited. Smoking reduces oxygen delivery and constricts blood vessels. Eliminating these stressors removes barriers that block the healing process. When you stop harming the nerves, the body can focus on repairing them. Patience is necessary because nerve regeneration is slow compared to other tissues. Small improvements often appear first. A slight reduction in burning, a small return of sensation, fewer episodes of sharp pain. Benefited. These changes signal that restoration is underway. Progress may not be dramatic, but it is meaningful. Healing nerves is not about one single supplement or one single exercise. It is about creating a supportive ecosystem inside the body. Fitted. Improve circulation. Provide essential nutrients. Reduce inflammation. Encourage stimulation. Prioritize rest. Manage stress. Remove toxins. When these elements align consistently, the body begins to rebuild what was once damaged. Fitted. The process requires commitment, but the nervous system is resilient when given the fitted opportunity to recover. Nerve health is not determined by one appointment, one supplement, or one temporary change. It is shaped daily by habits. The nervous system responds to patterns. What you eat consistently, how much you move, has benefited. How well you sleep, how you manage stress, and the choices you repeat every day create either an environment of healing or one of continued irritation. When you understand this, benefited, you stop looking for a quick fix and begin building a lifestyle that supports recovery from the inside out. Blood sugar stability is one of the most powerful daily habits you can develop. Benefited. Frequent spikes in blood glucose strain blood vessels and damage delicate nerve fibers over time. This does not only apply to people diagnosed with diabetes. Benefited. Even repeated high sugar meals and refined carbohydrates can gradually create stress inside the body. Choosing whole foods, increasing fiber intake, balancing meals with protein and healthy fats, and avoiding constant snacking on processed carbohydrates can dramatically stabilize blood sugar levels. When blood sugar remains steady, inflammation decreases and circulation improves. Over time, this stability reduces ongoing nerve irritation. Benefited. And inflammation control is not achieved through a single anti-inflammatory food. It is the result of consistent dietary patterns. Highly processed foods, sugary drinks, excessive seed oils, and chronic overeating increase inflammatory markers. Benefited. On the other hand, colorful vegetables, leafy greens, berries, fatty fish rich in omega-3 fatty acids, nuts, seeds, olive oil, and adequate hydration lower inflammation gradually. When inflammation decreases, nerve sensitivity often decreases as well. Fitted. Many people notice that their burning or stabbing sensations lessen when their overall diet improves consistently over weeks and months. Movement is another foundational pillar. A sedentary lifestyle reduces circulation, weakens muscles. Benefited and slows metabolic processes. You do not need intense workouts to support nerve health. Gentle daily walking, stretching, light resistance exercises, and simple foot and ankle movements can significantly improve blood flow to peripheral nerves. The key is consistency. 10 minutes every day is more powerful than one exhausting session once a week. Movement acts like a pump, pushing oxygen-rich blood into tissues that need repair. Over time, this steady circulation supports regeneration. Sleep is where deep repair occurs. During restful sleep, the body regulates hormones, reduces inflammation, balances blood sugar, and repairs tissues. Chronic sleep deprivation increases cortisol, elevates blood sugar. Benefited and amplifies pain perception. If you consistently sleep only a few hours each night, your nervous system remains in a stressed state. Prioritizing 7 to 8 hours of quality sleep creates a stable foundation for recovery. Benefited. Establishing a regular bedtime, limiting screen exposure before sleep, and creating a dark, quiet environment can significantly improve sleep quality. Stress management is often underestimated but deeply connected to nerve pain. Fitted. Chronic stress activates the fight or flight response. Blood vessels constrict, muscles tighten, inflammation increases, pain signals feel stronger. When you remain in a constant state of mental tension, the nervous system becomes hypersensitive. Benefited. Simple breathing exercises, prayer, meditation, time in nature, journaling, or quiet reflection can calm the stress response. When the parasympathetic nervous system activates, circulation improves and pain perception decreases. Managing stress day. Benefited. ILI prevents the accumulation of internal tension that worsens neuropathy symptoms. Avoiding harmful substances is part of a healing lifestyle. Excessive alcohol directly damages nerve tissue. Smoking reduces oxygen delivery and constricts blood vessels. Overuse of certain medications without proper supervision can also affect nerve health. Removing these harmful inputs allows the body to focus its energy on repair rather than defense. Benefited. Healing requires not only adding positive habits, but eliminating behaviors that sabotage progress. Hydration must become routine, not occasional. Water supports blood flow, nutrient transport, and toxin elimination. Dehydration subtly reduces circulation efficiency, especially to smaller blood vessels that supply peripheral nerves. Fitted. Drinking adequate water throughout the day maintains internal balance and supports every healing process taking place inside your body. Food care and body awareness are also daily responsibilities when living with neuropathy. Benefited. Reduced sensation increases the risk of unnoticed injuries. Inspecting your feet, wearing supportive footwear, and avoiding prolonged pressure on sensitive areas prevent complications. Small daily benefited. Precautions can prevent larger problems later. Patience is one of the most important aspects of a healing lifestyle. Nerve regeneration takes time. Weeks may pass before noticeable improvement occurs. Months may be required for significant change. Benefited. The mistake many people make is stopping healthy habits too soon because results are not immediate. Healing is cumulative. Each healthy meal, each walk, each night of good sleep, and each moment of stress control adds to your progress. Fitted. Small daily efforts compound over time. A healing lifestyle is not about perfection. It is about direction. Occasional setbacks will happen. What matters is returning to supportive habits consistently. The nervous system is adaptable. Fitted. It responds to repeated signals. When you repeatedly signal safety, nourishment, balance, and movement, the body adjusts accordingly. Benefited. You have more influence over your nerve health than you may believe. Your daily choices either strengthen or strain your nervous system. When those choices align with stability, nourishment, and consistency, the body gradually shifts toward recovery. Benefited. The process may be gradual, but steady, intentional habits create long-term change within the nervous system. Burning, numbness, and stabbing pain are not random punishments. They are signals asking for attention, correction, and change. Throughout this message, the focus has not been on masking discomfort, but on understanding it. Nerve pain is rarely just about the nerves. It reflects blood sugar imbalance, inflammation, poor circulation, nutrient deficiencies, stress overload, benefited, and daily habits that quietly shape your internal environment. When you address these deeper roots, you shift from temporary relief to true restoration. Healing neuropathy requires a different mindset. It requires patience over panic. Benefited. Discipline over desperation. Consistency over quick fixes. Every stable meal, every glass of water, every step you take, every hour of quality sleep, and every moment you calm your stress response is an investment in your nerve-fitted system. These daily actions compound. They create a biological environment where nerves are nourished instead of irritated, supported instead of strained. The body is designed to repair. Nerves can regenerate. Circulation can improve. Fitted. Inflammation can decrease. Blood sugar can stabilize, but healing demands participation. It demands that you remove what harms and consistently provide what heals. Small improvements may appear first, slightly less burning, fewer sharp episodes. Fitted. A little more sensation. These are not small victories. They are proof that the body responds when you change the conditions. You are not powerless in this process. You are not defined by the pain. Benefited. The nervous system is resilient when given the right environment. True recovery is built through steady habits, balanced nutrition, gentle movement, stress control, and unwavering consistency. When you commit to transforming your internal environment, benefited, you create the foundation for long-term nerve health and overall vitality. Your healing begins the moment you decide to treat the cause instead of chasing the symptom, and that decision starts today. BYEBE Car Fuel L.